I'm Jason Heath, I'm a GP in Lewes. I work at Foundry Healthcare Lewes, and it's good to have a chance to talk to you today.
Yes, thanks for talking to us today. We feel it's really important to let the local people know the situation from an expert like yourself. Can you touch on the second lockdown and the differences to the first one from a medical point of view?
Certainly, yeah. First of all, I think the second lockdown was quite important to do. We could see heading into winter with all of the other pressures on the NHS, looking at the graphs, however you might want to debate the graphs, that there was a significant potential for a further significant rise in cases, and I think the timing was right to take the steam out of the rise in cases and the potential for hospitalisation and avoidable deaths. So I'm very much of the opinion it was an important lockdown to go into from both a health point of view, but also it's been managed differently this time, and I think for the right reasons, keeping businesses open, trying to keep some element of the economy and people's lives going, schools and universities. And because we know more about the disease, because we know more about how to manage it, how to prevent it, I think we're able to manage that in a responsible way. We're also continuing to provide pretty much as much healthcare at primary care level as we can, take into account the fact we need to do social distancing. We can't see as many people face to face in quick succession, but we're certainly seeing easily the same numbers of people either by phone contact, video contact or face to face. So second lockdown feels different. We feel more confident we can manage the risks, we can treat the condition, hospital outcomes are improving, but we're also really keen to keep other services going and make sure that people's health doesn't suffer in other ways.
Yeah. So that is one of the differences, really, that it's important to make it clear for this lockdown that people continue to come to the surgery for non-COVID issues, or even something that might be loosely related to COVID, the anxiety or the mental health. Can you touch on the types of services you're still continuing throughout this lockdown?
Certainly. Well, first thing to say is a vast percentage of the contacts are initially by phone, and that's for everybody's safety. We've got obviously vulnerable patients that we don't want to be mixing with at-risk cases. So by coming to the surgery, come to the surgery first by phone, but if we need to see someone for clinical reasons or for other reasons, we will arrange either a video consultation or a face-to-face consultation. So we definitely want people to come if they have any concerns over their health. That might be a new symptom, an ongoing chronic illness that needs some attention, particularly mental health concerns, either ongoing mental health conditions that may be troubling people or new mental health worries. And understandably, lots of people are dealing with anxiety, with low mood, with social worries, financial worries, and those problems we can also help with. We can either help ourselves or we can direct to other supports. We've got some excellent work from our social prescribers who can provide really good contacts with other organisations that can support people at this time with things that aren't necessarily immediately medical but have an important impact on health. Yeah.
Okay, great. And any advice for the public that you'd like to make clear? Some people might be confused about social behaviours for this lockdown. Anything you'd like to make clear for them?
We've heard it so many times, haven't we? The different versions of how we should be practicing social distancing, masks, respecting people's space, being responsible for ourselves if we feel unwell, getting a test. There's been some element of people being reluctant to get a test because of the fear of the consequences of getting a test, but far better to get a test and be reassured, or take the responsible action and to practice the necessary distancing and isolation advice. But I think it's about getting through this as a team. It's about a community effort, not just can I stop myself from getting coronavirus, but can I stop other people from getting it by my behaviours, my actions, my attitudes. So it's about being socially responsible, it's about being kind, looking out for people that might need some help, having an extra ear for someone who might be running into some difficulties that you might be able to help with. But I think the next big challenge is going to be the vaccine and how we how we all approach and react to that, because that can create anxieties, but also I personally am very excited about that as a potential for getting us to a place where we can begin to live a bit more back to normal again.
Yes, yes. And how has the surgery been impacted by the pandemic?
It's been a huge time of change from a point of view of not having so many people. Our job is about seeing people. My last 30 years of practice has been face-to-face consulting. So that's been a massive change, and we've had to really look at our communication skills for telephone consulting, video consulting. We've had to ask our patients to be patient with us in terms of difficulties getting through, difficulties on the phone, difficulties with getting some of the basics. Electronic prescribing has come in at the right time. So we've made huge adjustments. We've also had the benefit of the Urgent Treatment Centre up at the Victoria Hospital, which is run by very well-trained paramedics and nurse practitioners. But we've had just such a really good response from our team, from our receptionists, our nurses, our admin team. And because we've come together now as one primary care network covering the whole of Lewes, we've got real flexibility in how we use our workforce. So I've been really proud of how we've coped. Sure, we haven't been able to do some of the routine stuff, so some things have had to be left, things that are not immediately clinically necessary. But we're beginning with the second lockdown to look at case-by-case assessment. So even if somebody needs something relatively basic, like an ear syringe, if it's causing them distress, we will arrange to do that. So we're trying to be person-centred rather than following blanket guidelines.
Okay, that's lovely, and thank you for everything you're doing for the Lewes community and all the hard work for your staff.
Well, I'd like to thank our staff, but also the community. It's a massive community effort.
Great.
So thank you.
Okay, thank you so much for talking to us today.
Pleasure.
Thank you.